Good morning, good afternoon, good evening. My name is Rich Clark, Guide to the Right Path, and as a therapist I am going to talk about this week about anxiety. So I've done part 1, which has been released on Monday. For part 2 I'm going to do about what is anxiety, part 2, and what therapy techniques I would use to help relieve these issues with anxiety. So therapeutic methods I'd use, I'm going to break them down to the things I do. So CBT, hypnotherapy and psychotherapy. So the first one is CBT, which is very useful, is restructuring and reprogramming and challenging the cognitive patterns of anxiety onset. So within that, when you're restructuring and challenging that, is you're changing the way you react to that, what patterns you go to that, and how that goes to your anxiety and where it's going to be preemptive before the anxiety attack happens. Next one is the reframing and restructuring the triggers of worrying, and these are the fearful thought patterns. So fearful thought patterns is also caused within that because it causes different things of the GAD, general anxiety, depression, PTSD. It's always that idea of that. So how do we not get triggered or affected by that before we have the anxiety attack or so forth. And then ERP, which is called exposure and response prevention, a technique that slowly exposes clients to anxiety triggers while preventing typical symptoms. This is done with many people when we're talking about when they have a fear of a snake or so forth, but we also can do that when we get into these situations if someone has a fear of flying or fear of blood or things like that. So you would actually, with some clients, if it's not done online, you could actually work with them and go to places, put them in these situations and then actually work with them and teach them techniques to get over that. The hypnotherapy tools I would use to actually help a client get over any of these anxiety things I've mentioned on Monday or general anxiety issues is guided imagery to reframe the triggers that cause the anxiety. So reframing the triggers is actually going back and actually looking at what triggers these before you get the anxiety. And when we call it reframing, it's basically reprogramming the brain and reprogramming the mindset of how we look at that. Suggestion therapy to address these deep down behaviour issues, emotions or repressed memories. And then challenge the emotional issues by visualising their client's personal timeline. The client will be guided through their memories to resolve past trauma that affect their current behaviour. And so when you hear of timeline therapy, is that when you put someone under hypnosis, you go to the first time that they ever had an anxiety attack, the first time they feared this or had this issue of post-traumatic stress disorder, and you always go back to the first ever version of this. Now, with most clients, I'd probably say it's usually in childhood. That would be, I would say, 70 to 80%. There are some are more teenagers, adolescents, and then there's some are more adult things. People do change with bereavement. They can get more traumatically stressed or have anxiety. And then the combined approach, which is using the following, and these are using holistic ideas to help people, is breathwork or pranayama exercises to change the level of anxiety. Now, pranayama and breathwork is that you do a certain breathwork and that would actually calm the heart rate down, calm the body down, and it also inadvertently calms the nervous system down. Setting up schedules is that track weekly and eventually help regulate anxiety activity. So this would be done with the client to work out a diary system of how that happens, why that happens, and then actually give them the procedures to work with. Do they have like something like a physical thing they do to touch their fingers, touch their arms, whatever that is, or touch somewhere to stop them having them anxiety attacks. That's why you see some of those children, they do certain things. This is something they're kind of programmed to do as a natural thing, but we also teach that to adults as well. And then the far long term create relapse prevention strategy. So the relapse is that when you are okay with anxiety and you don't deal with it, but then also that time when something could trigger you and you have to work with that and come up with something to do with that. So hopefully, with all them things I've mentioned, and there's more, but obviously I'm just doing the brief on that, that with that we can use them strategies within sessions which we would help someone with. So if you are interested in sessions and you want to relieve any of the anxieties I mentioned before, but also these techniques, I could go into more detail, and you do that with a discovery call, and my website to book that would be www.richclark.net, and I hope to hear from you soon. And after the discovery call, we can work on a program or work on a system that would help you get over your anxiety. And as of tomorrow, I'll be talking about as anxiety part 3 about some case studies and some general case studies I've done and what I did to help people who had a form of anxiety. Their anxiety mainly was generalised anxiety disorder, and what I did to help them with overcome that. So until next time, speak to you soon.